Hello and welcome again to my channel. I remain your baby's doctor, and today we'll be talking about 5 mistakes to avoid when helping a convulsing child. I know witnessing an episode of convulsion can be very scary. Watching a child go unresponsive, become stiff and starts jerking can be very distressing, but well, that is why we are here to let you know what to do when this happens. Convulsion is actually more common than you think. Quite a number of children will convulse in their childhood. In the past 1 month, I must have seen about 15 children come to the emergency room with episodes of convulsion. This can be due to different things: fever, febrile illnesses, and in some cases some epilepsy syndrome. So it is not really uncommon to see children convulsing. So it's very important to know what to do when this happens, and this is why we are here with this video. So before I go on with this video, I would like you to click the like button, subscribe, share, and click the notification bell so that you can get notified each time I post a new video. Welcome back. So let me continue by telling you a short story about a new mom, a young woman that came into the emergency room with a few months old child who was set to be sleeping and suddenly started jerking from sleep. But the woman came in, she was agitated, shouting for help, calling for help, her finger was bleeding, and we had to find out what was going on. We asked her a few questions and we discovered that the child had fever and then started convulsing in the course of the night. Of course, the mother tried to help the child by putting the fingers in the child's mouth, which is one of the things you shouldn't do when you have a child that's convulsing. So let's get to it. Put your finger in the mouth. I believe you remember the story I told you a moment ago about the mother that put her finger in the child's mouth. Please do not put anything in the mouth of a convulsing child. Do not put your fingers. Do not put any cutlery, spoon, fork, whatsoever. Do not put anything in the mouth of a convulsing child. Apart from causing injuries to yourself, you can also cause injury to the child that is convulsing. You can dislodge the tooth, and when this is dislodged, it can lodge in the airway, which can be fatal in a lot of cases. And we don't want this. We don't want something that can be treated to cause problems that may not be treated or recovered from. So please do not put your finger in a convulsing child's mouth. Mistake number 2. Do not give anything to eat or drink. This is very similar to what I said earlier. I know that a lot of us believe that children convulse because they have low blood sugar. As true as this may be, the solution to this problem is not to give something to drink or eat. Because truthfully, a child that is convulsing is not aware of anything that is happening. So when you give something to eat or drink, the child is not likely to swallow. And when the child does not swallow, the food or the drink will find an alternate route, which is likely the airway, and then can cause obstruction of the airway, breathing difficulties, and that also can be fatal. So please do not give anything to eat or drink when a child is convulsing. Mistake number 3. Now this is very common where I come from. Do not give verbal concoctions. I know you have neighbors, you have grandmothers, you have old people that have homemade remedies that they believe work for convulsions. Herbal concoctions are not things you should give to convulsing children. Apart from what I said earlier about it getting lodged in the airway, herbal concussion have their own adverse effects on the kidneys and the liver of children. I know we all say that, yes, this is where we get our medications from and all, but we don't know the dose of what you have in the herbal concoction. I will not really flog this here. I will post a video later where we talk about herbal concoction and the effects on children. But please do not give, oh my goodness, I remember that cow urine concoction that they give to children. Cow urine! Cow urine! And you tell parents to take it and they cannot take it. So please do not give herbal concoction to children that are convulsing. number 4, inflict pain. Now, this is one of the things that a lot of people do that I am very, very uncomfortable with. They will come to the emergency room with a child with a history of convulsion, which means it happened a while back, but they are presenting with burns injury, with scars, even sometimes with tetanus infection, because they inflicted pain. They were trying to inflict pain to make sure that the child becomes responsive while convulsing. This does not work. They might have been doing that in the past, but it does not work. It does not add anything, any value whatsoever to the care of a convulsing child. It is very painful when the cause of the convulsion, maybe a febrile convulsion due to fever, had been treated, and then we are here trying to treat burns injury, to treat some form of disability that the child may have acquired from the so-called treatment of convulsion. So please do not do anything to inflict pain on a convulsing child. I know a lot of us might have witnessed some things that I did not talk about in the management of a convulsing child locally. I would like to know what you do or what people do around you. I would like to know if you've experienced or you've witnessed an episode of convulsion, and I would like to know the reaction of people around you and what was done. If you also have any questions, any concerns, comments, please do well to comment in the section below, and then I'll be here to respond. Tip number 5, run away. Yeah, I know this may sound funny, but it's true. The natural human has 3 instincts: fright, flight, or fight. I am likely to pick flight after fright. I'm not likely to fight. Alright, so which is the usual thing that you would expect from someone that witnesses a child convulsing on the streets. You have never seen it before. You just suddenly see someone convulsing on the street. The first instinct is to run away. But please, I would like to state here, right now, that convulsions are not contagious. So the saliva of someone convulsing cannot infect you. You cannot convulse by seeing someone convulsing. So please help such a person. Do not run away. And I will tell you shortly the things that you would do when you see a child or someone convulsing on the street. So you see a child convulsing on the street. The first thing to do is to make sure that the environment is safe. So move yourself and the child to a place that is safe. That is, the floor is flat. There are no objects that are around that can injure the convulsing child. You want to remove the restrictive clothing. You want to remove any sharp objects from the body and allow the person convulse. So while the person is convulsing, if there are emergency response systems that you can call, 911 in some places and all, please call for help so that the child can be moved to a hospital as soon as possible. But please do not run away from a convulsing child. If this video has been helpful, and I know it will be helpful to a lot of parents and caregivers, so please do well to share, like, click the notification bell so that next time I post a valuable video like this, you'll be the first to know. Also subscribe. I'll be here to respond to your comments, your questions and queries. It was really, really nice hanging out with you. I remain your baby's doctor. Thank you for hanging out with me. See you next time.